See, what were the symptoms they would notice in themselves if they, had this, and it was a subtle kind of thing?
In postmenopausal women, it would be more the fatigue, the depression, a little bit of weight gain. Memory loss is quite common. Of course, we all lose a little bit of memory with aging, but still it would be useful to have that blood test you mentioned and make the diagnosis.
Is it more common in men versus women?
No, more common in women, but not unusual in men, and most common in those men or women who have a family history of thyroid disease. So if anyone in the family had either hypo or hyperthyroidism, the overactive thyroid condition, they are more likely to also have thyroid disease, particularly hypothyroidism.
How do you treat this kind of thing?
It's very easy to treat. One simply takes synthetic pure thyroid hormone. The chemical name is thyroxine, abbreviated sometimes as T4. And thyroxine is a natural body hormone. It's exactly like the same thyroid hormone produced by the normal thyroid gland. So it's really not a drug. And taken in the appropriate dosage, there should be no side effects whatsoever.
Is it a curable condition?
Well, if you continue taking the thyroid hormone medication, you're essentially cured, but you have to take it for life. If you stop, then the hypothyroidism simply comes back. So it's curable as long as you take the medication.
And you should see a change in your symptoms fairly quickly?
Within days to weeks, yes.
Great. When we come back, we'll give you the latest information about thyroid cancer and what you can do if you get this diagnosis. Stay tuned. Thyroid disorders and thyroid cancer. Joining me again is Dr. Len Wartofsky. Dr. Wartofsky, how common is thyroid cancer in older adults?
Thyroid cancer becomes more common with age. So like other types of thyroid disease, it is more common in the later decades of life, and particularly the more aggressive types of thyroid cancer. So it is important to diagnose and treat early.
And how do you make that diagnosis?
The first step would be examination by a physician, typically the family practice physician, the internist, or specialist called an endocrinologist. The endocrinologist deals particularly with thyroid disorders, and they examine the neck, and if they feel a nodule or lump or mass, the next step is to insert a very skinny, fine needle to do what's called a fine needle aspiration. And that obtains cells that are looked at under the microscope, and one can determine if a given nodule is benign or malignant.
If I don't see the doctor, or if he doesn't examine my neck, as you talked about, how would I know I had thyroid cancer? Are there symptoms or signs that might tell me that I'm at risk?
Often when you get symptoms, it's a little late in the process, but still important to be evaluated. The symptoms could be pain in the area of the thyroid in the front of the neck, difficulty swallowing, or hoarseness or a sense of pressure. But often when those symptoms arise, the tumor has already spread beyond the thyroid into the surrounding neck tissue. Typically what's found is a spouse or friend sitting across from the patient might notice a lump in the neck as the patient swallows, because the lump will move up and down with the thyroid gland. And that typically would bring a nodule to medical attention.
So a routine part of every physician's exam in their annual physical or physical if they get should be checking their thyroid, it sounds like.
Yes, it should. Absolutely correct.
Now, once this is diagnosed, they go through, obviously they get a scan or they get an x-ray. Is that what happens?
Well, the fine needle aspiration cytology is the most important step. A scan can be useful as well, but if the biopsy or cytology is positive, the next step is surgery.
Okay. And what happens in surgery? Do you have to take the whole thyroid out, or?
Yes, it's best to take the whole thyroid out, what's called a total thyroidectomy. And that removes typically all of the cancer, Many patients after that need to have some supplemental therapy with radioactive iodine. And that's simply taken by mouth. It's not external radiation as is done for other types of cancer, and that can be curative in perhaps 90–95% of patients.
Dr. Bortowski, thanks for joining us. Wonderful information.
It's been a pleasure to be here, Kevin. Thank you.
Up next, we'll give you a quick recap about today's Healthline topic, thyroid disorders. And we'll tell you where you can find more information. So please, stay tuned.
What if you could travel the world, explore the places you've dreamed about, without the planning, navigating, or worrying about the details? Guided travel, where your only job is to have the time of your life. At Colette, we think travel should be easy and convenient, no matter where you choose to go. It starts with VIP service to and from your doorstep. Your flights, hotels, and meals are all taken care of. You'll have exclusive access to museums and attractions, so you can spend more time enjoying and less time waiting. All in the company of the top tour managers who give you a real perspective on the region's history, food, and culture. When you tour with Colette, you'll meet new people, make new friends, and discover hidden gems you won't find in any guidebook. Call Tour and take a closer look at over 150 tours and itineraries all over the world, starting at just $1,149. Whether you like a more structured trip or more time to explore on your own, there's a Colette experience for you, by land, by river, or even a little of both. From quick getaways to more than 2 weeks. So go ahead, set out on an African safari, sleigh ride through Yellowstone, see the northern lights, or marvel at the Californian redwoods. Don't wait. Industry experts give Colette top honors over and over, and 98% of people who travel with us would choose Colette again. Right now, you'll save up to $500 on select Colette tours. So call 844-435-3064 for your free brochure today and find out how easy it is to take the trip of a lifetime.
Welcome back to Healthline. I'm Dr. Kevin Soden. Thyroid disease can cause many symptoms, from fatigue and weight change to depression, anxiety, and hair loss. So, let me give you an example. If you've suddenly lost a lot of weight without really trying, fat chance of that, or you're really just low on energy, it might be time for a thyroid checkup. If you'd like more information about thyroid disorders or thyroid cancer, you can contact the Thyroid Foundation of America at 1-800-832-8321 or visit their website at www.tsh.org. If you have any questions or comments about Healthline, visit our website at www.rl.tv. That's it for this edition of Healthline. Thanks for watching. Until next time, just wishing you the best of health.